How's it going, guys? We have a pass level question for step 1 and step 2, okay? If you think this question's weird, don't take it up with me, take it up with the nbme exam, okay? It's littered with these types of questions. So before we get started, please subscribe to my channel, I really appreciate it. Give the video a like, I really appreciate it. Find me on Instagram at mehlman_medical, mehlman_medical, links down below. Find me on Telegram, links to the Telegram group and channel are down below. Let's start the clip. So 50-year-old woman, she has gradually increasing back pain for 3 weeks, no history of trauma, she's a non-smoker. Blood and urine findings normal. X-ray of the spine shows 2 lytic lesions at T11 and L2. Question wants to know the most likely diagnosis. So let's just whip through the answer choices here. We'll go backwards. Choice C, renal osteodystrophy. Wrong fucking answer. 0 in this question has anything to do with renal, and let alone the fact that we have normal blood and urine findings. Okay, so if we had renal failure, we'd have increased creatinine and renin. Renal osteodystrophy just refers to bone, any bone change that could be caused by renal failure, okay? It's almost always osteomalacia, vitamin D deficiency. They could just tell you, like, woman who's 63 has renal failure and she has hip pain. X-ray of the hip shows pseudofractures. That's a buzzy finding that's seen in osteomalacia. And then the answer could just be osteomalacia or renal osteodystrophy. In this case, wrong fucking answer. Choice D, osteosarcoma, wrong answer. Patient doesn't fit the classic demographic, okay? It's usually 15 to 35-year-old male, okay? It would be a lesion of the femur or distal femur, proximal tibia. You need to know osteosarcoma can also be seen in patients who have congenital retinoblastoma. USMLE loves that. They'll give you a 1-year-old who had an enucleation of the eye. They say, what's the patient at increased risk for later in life? Osteosarcoma. Osteosarcoma also increased risk in Paget disease, okay? So I'm going to be aware of. Wrong fucking answer. Choice C, osteoporosis, wrong answer. So some students will erroneously choose this thinking this relates to lytic lesions. It doesn't, okay? Lytic lesions is a finding that could be seen in multiple myeloma as an example, not in osteoporosis, okay? Compression fractures is what we see in osteoporosis. Now that is exceedingly high yield. They say compression fractures of the vertebrae, exceedingly high yield for osteoporosis, long discussion. You should be aware that calcium, phosphate, ALP, and PTH levels, all normal in osteoporosis. They could give you a pituitary lesion, and they'll tell you that there are compression fractures of the spine, and they'll say, what's the pituitary secreting? And the answer is ACTH. I'm letting you think about that for a second. It's because ACTH can cause cortisol to go up, right? Cushing disease. And that can cause osteoporosis, okay? Students choose prolactinoma for that. It's the wrong fucking answer. In this case, wrong fucking answer. Choice B, breast cancer is the correct answer. Now, as I said, don't take it up with me. Take it up the nbme exam if you think this is weird. This is what USMLE does. So they'll just give you a woman who's 50 who just randomly has back pain or lytic lesions. Notice multiple myeloma is not listed as a confounder here, right? So they just give you breast cancer. It's metastatic disease as the answer. Okay, often patients have no past medical history, and then unfortunately will just present with metastatic disease. And they can do the exact same fucking thing with a dude who's 50 and it's prostate cancer. They'll say blastic metastases. That's easier. Okay, they'll just say dude who's 50, no past medical history. He's got 2 blastic lesions of the spine. Answer is just prostate cancer. Okay, so this is what they like doing, and TCK in particular can take this a step further, and they like turning this into Cauda-Equina syndrome, okay? Like, they'll just give you a 50-year-old woman who has urinary retention and leg pain, and the answer would be epidural spinal cord metastases, or metastases to the Cauda-Equina, or metastatic breast cancer. And students think that's really fucking weird. Well, as I just fucking said, it's what the nbme exam will do. So avascular necrosis, wrong answer. So I mean, obviously very generic, long discussion. We could have similarly, as I mentioned before, ACTH causing Cushing disease, where if they just said there's hip pain in that patient, rather than compression fractures where it's osteoporosis, is that they just said hip pain, well, that could be avascular necrosis from high cortisol. Glucocorticoids in general, avascular necrosis, can be sickle cell causing avascular necrosis of the femoral head. It can be leg calf Perth's, idiopathic. It can be Gaucher, okay, glucose cerebroscitis deficiency, lysosomal storage disease. Wrong fucking answer. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.